Hi, I'm Kelly Watkins. Sorry I had a bit of a problem uploading everything. I'm just checking that assuming that this is still going live, which is good. So I just wanted to go through a few questions. So I'm planning on doing a question and answer session. So I am a CBT therapist and a forensic psychologist, and I've got a few questions that people wrote in the group that I wanted to go through. So to start off with, a lot of people were talking about emotional eating. So often when we eat in a reaction to how we're feeling. Sometimes we eat because we're bored, sometimes we eat because we're stressed. And one of the things that we can do when we are thinking about emotional eating is to simply create a log. So notice when we're eating, notice why we are eating. And that can be really key to noticing what emotions make us more likely to eat, or what emotions make us more less likely to eat. And with that, sometimes we need to think about how we actually eat. So are we eating things because they are really clearly accessible to us? So we may want to think about changing the accessibility of the food that we're able to get to. So for example, if you know you always come in from work, you're feeling quite stressed, and you go straight to the cupboard in your kitchen and you pick out something which maybe isn't the best choice for you, you may want to change really where your food is in your cupboard. So you're breaking that connection of the behaviour. So that is something that is really key. So if you log your emotions, notice when you're eating and what you're eating, and getting a really clear idea of the patterns of your behaviour. And sometimes there's been some research that says actually where you place your food can make you more or less likely to eat it. So for example, if the food is quite accessible, so if your food is just next to you where you're sitting versus if your food is far away, so if you've got further to go and get your food, you've got more of a chance to actually change those thoughts in your mind of what you're going to eat. And I've written an ebook about mindful eating, which I can share to anyone who would like to have it. And it just helps to change that connection to your food, so kind of bringing mindfulness in, so being more aware of what you're eating, why you're eating, and that sort of thing can be really, really helpful. And then in terms of your emotional eating, changing, having an alternative. So again, going back to that log idea, if you then know that you always eat when you're stressed or when you're sad, think of something else that you can do rather than eat. So whether that is reading a book that you enjoy, whether it's listening to some music. So you want to alternate the behaviour between what you would normally do, eat, and what you could do instead. And again, you could bring that into the log. So you can look at, so the behaviour is eating, and then try out some alternative behaviours. You want to think, what void is the food trying to fill? Is the food trying to relax you, or is the food trying to make you feel happy? And then alternate behaviours with that. So that was something that a lot of people asked about to do with the emotional and behavioural eating, and I think those tips kind of cover that. But we know we often eat for a certain thing, so the main thing is to figure out why we actually eat. So the second thing that a lot of people asked about is stress. So with stress, again, going back to those emotions, we often eat because we are stressed, or we eat because we think that that's kind of a way that we can deal with the stress instead of actually addressing the stress kind of head on. So when you look at stress, everyone's got different levels of stress that they can deal with. So for example, if you imagine a jug, so your stress level may be up to here normally, what other people's could be down here or up here. And then between your level of stress and the top of the jug, that's called your buffer zone. So that's basically how much additional stress you can take on. So imagine your buffer zone's that big. Sometimes you may have little bits of stress that just drop in, And that's fine, because you can empty that stress out through your stress reduction methods, whatever they may be. But sometimes you don't empty your stress, then it starts to fill up to the top of the jug, or you get something that's really, really stressful. So all of that stress is flying in and you're getting right to the brim, and then it overfills. So that's when we feel really overwhelmed, really just overwhelmed with emotions, overwhelmed with stress, and not really knowing what to do with it. And that is often when we kind of go to our automatic responses, which could be eating. So it's about understanding what stresses us out, how we normally manage our stress, and what stress is comfortable for us. As humans, we all live with a certain amount of stress, but it's really working out what level of stress is okay for you, and not comparing yourself to other people. Often we'll look at other people and think, well, they're managing to juggle around so much stuff, but I'm not able to really juggle that out either. And that's okay, because we are all in different levels of being able to manage the different things. And a lot of people were talking about the overactive brain. So really being overwhelmed with thoughts, having that constant narrative. And research has shown that we can have up to about 60,000 thoughts a day. That's an incredible amount. And just think, how many of those thoughts are you actually consciously aware of? And sometimes we get these thoughts, and often one thought will lead to another, and we kind of spiral down this thought rabbit hole almost. And the idea of being able to work with those really overactive thoughts is to start to recognise what we're thinking. Maybe start to challenge some of the thoughts that we're having. And this can be through loads of different techniques. It could be about just labelling the thought for what it is. So instead of taking that thought as true, we often think that our thoughts are facts, but really they're just our opinion of certain things. And so it's about really kind of being aware, asking yourself when you have a negative thought, asking yourself, is that a fact or is that opinion? And then being able to manage it that way. And then kind of seeing if our thoughts are a prediction of something. Often when we have a thought, we're predicting that something's going to happen, or we're thinking back to a previous memory and assuming that the situation that we're currently in is going to be the same as what it is before. And they're kind of you really want to understand your thoughts, because our thoughts influence our behaviours, which obviously will then either increase or decrease our stress. And a really easy way to challenge our thoughts is recognise what the negative thought is in your mind. So say, for example, I'm not going to get anywhere. And then really look at, okay, what's the evidence of that thought being true? So what's the evidence of that you're not going to get anywhere? See what evidence you have for that. Sometimes I like to say to my clients, imagine that you're standing up in court and the judge is asking you, what evidence do you have for that being true? So really, what evidence do you have to present? Then you want to think, what evidence do you have for it not being true? So this is the tricky part. So now you want to see, what do you have that proves that that thought isn't true? Okay? And then once you've got the evidence for and evidence against, then you can think of an alternative, more balanced thought. So instead of having that real negative thought that's making you stressed, making you feel overwhelmed, you've got an alternative thought. So imagine if the automatic negative thought at the beginning was, I'm not getting anywhere. An alternative thought could be, I maybe not be progressing as quickly as I want to, but I'm on the right path. So you're still not you're not damning yourself, and you're not really putting yourself down, and you're recognising that there's some room for improvement, but you're not being really, really negative. So often, as I said, with our thoughts, with our emotions, particularly with stress, our thoughts are really what sometimes causes us problems. So you want to reframe the thoughts, trying to challenge them, seeing if they're fact or opinion, seeing if they are a prediction of something, and saying that when we have anxious thoughts, so when we have worrisome thoughts, often we think that they are current problems, but really they're predictions and they're hypothetical problems. So when you next have an anxious thought, ask yourself, can I do anything to solve this thought? If the answer is no, then it's more of an anxious thought. So it's a prediction, it's something that's hypothetical. But if there is something that you can do it, then you can problem solve it. So you can work on practical ways to solve it. And again, just being more in control of our thoughts, you're going to be more in control of your stress. Another way, kind of going back to the relaxation and the meditation element to reduce your stress, so getting that buffer zone down in that jug, is to refocus your attention. So if you're feeling really, really overwhelmed, you want to refocus your attention on the now. So to do that, you can say to yourself, okay, what are 5 things that I can see? 4 things that you can feel, 3 things that you can hear, 2 things that you can taste, and 1 thing that you can smell. And when you are truly in the moment, it's really difficult for you to get wound up by the thoughts, for your stress levels to increase, your anxiety to increase, anything, because you are truly in the moment. So to refocus your attention in the now is a really key way. And as I mentioned with the mindfulness ebook, that will be something that will be really key to help you to be in the now, to be more in control of your emotions, more in control of your eating, rather than, as I said, using your eating as a coping mechanisms. You want to change your relationship, get a more healthy relationship with your food. And I think someone else actually asked a question to do with stress is, can you be stressed and not know? Completely. Sometimes we all live, going back to that jug idea, we all live in a world where we have certain levels of stress. And if we are so used to riding on this one level of stress, it's going to be completely normal to us. So when people are kind of saying that they're stressed or they're overstressed, for you, you may not even recognise your experience as stress because it's been the same for you your whole life. And that again is where some sort of log can come in. So you start to understand your emotions, because sometimes we fly through life not really understanding our emotions, not really understanding what's going on for us. So yes, you can completely be stressed and not knowing. And also the language. We may use different language to actually explain when we're stressed. Some people might use the word overwhelmed. Some people might see it as sadness. And the language that we use sometimes can be so key, that our language sometimes doesn't match up with how society sees certain emotions or how others see it. So kind of being aware of what emotion you actually are experiencing and being curious. And that's why the log comes in, because you can see sometimes really what you are experiencing. So I'm just looking at some of so that's kind of the main things about stress I think that I covered for the people that ask those questions. And someone mentioned in terms of carrying certain things around them to prevent something happening that they don't want to occur. And when we carry certain things around, whether the person that commented carrying around wet wipes and toilet rolls and things like that, feeling that they can prevent something from happening, that we need to be really curious about what are the function of carrying around things. For example, if you may always carry around snacks with you, or you may carry around certain things in your bag or in your pockets that reduce your anxiety. However, in doing so, it makes you believe that if you carry those things, will you not experience a negative outcome. And then it's almost that you always get trapped into carrying those things. So the key with that situation is to really be curious of what is the function of me. Am I being quite cautious? Am I being necessary? Or am I creating a safety behaviour? So safety behaviour is something that we do to either reduce our anxiety, but it doesn't actually help us. So I don't know if anyone's used calms or those sorts of rescue remedies, but they can become a real safety behaviour, because then we think if we don't have that with us, then we're going to have an anxiety attack or we're going to feel really, really anxious. But it's actually the connection to carrying it around which can make us anxious, because we're constantly thinking, worrying if we have it or worrying if we don't. So when we do carry things around, asking ourselves, what is the function? Is this rational? Is it a rational thing? And is it reasonable? And those key questions will help us to understand, and maybe even ask someone else. Like if you're carrying around toilet roll and wet wipes, arguably you don't need both. You probably need one or the other. And so just thinking about understanding why we're carrying it and what we could potentially do instead of actually allowing that anxiety to take hold, we could do something proactive with it. Another question would be overcoming difficulties with smells. So often when we smell things, we have memories attached to it. So I don't know if anyone's ever had some sort of food and they've become unwell. Then when we smell it, the olfactory memory is one of the strongest memories we have. Again, if we ever smell perfume, we go right back to the time that we smell that perfume or aftershave on someone, and even thinking of that person in general. But that's the same with food. So if you have a difficult relationship with a certain smell to do with a certain food, we automatically go back, and we go back this so quickly that we haven't even had a chance to realise that that's where our mind's gone. So when we're looking at smells, again, we're looking at what's that connection. What is the connection between the smell, my memory, and the emotion? It's almost like a triangular connection, really, because you've probably got the smell here, the memory, and the emotion. And as I said, you would fly around that cycle so quickly that maybe you wouldn't even realise. So the key with that is breaking that connection. So being aware, when you smell a certain smell, what are the thoughts that are coming out of your mind? Are you thinking, oh my God, I'm going to be sick? Are you then going back to the situation where it happened before? And where are you going with that connection? So being really curious to that and really working that out would be key. And to get over difficult relationships with things, when we have a fear or some real high anxiety, you do something called exposure response prevention. So within this, it's often something that you'd have to obviously do with a professional. But the idea of it is you create a hierarchy. So it's a hierarchy of feared foods or feared situations, feared scenarios, and you rank them from the most difficult to the most the easiest to achieve. And you start at the bottom, and you basically will work your way through the hierarchy, and you work your way up. However, within that, you don't want to do what you normally do. Say, for example, if you smell eggs and that automatically thinks of a time where you became really unwell, so you just avoid smelling eggs. So what you would want to do is, and if you know kind of the worst egg to smell would be a fried egg, but the most achievable would be like a scrambled egg. So you would start off by smelling a scrambled egg and sitting and smelling it, allowing all the memories to come, but not to do what you normally do, which is avoid. And this is, again, you can really link this over to social scenarios. So have a hierarchy of social situations where you may avoid, but then you'd want to stay in that scenario and not leave. Because when you avoid a scenario, so you feel really anxious or you feel really fearful, you either stop smelling the egg or you leave the social situation, your anxiety will drop. So you get rid of the anxiety. So for you, you're feeling happy because I don't feel anxious anymore, I feel fine. But really, you haven't learned how to deal with your anxiety. You haven't learned how to deal with that fear because it's just dropped. So then you go into the situation again, you avoid, and it drops. But with exposure response prevention, ERP, you will get in that scenario. So your anxiety will increase, but your anxiety can rarely stay in your body or fear for longer than 20 minutes at the peak. So if you stay in it for longer than 20 minutes, it's going to start to slowly come down, more like a bell curve rather than going down like that. And as it starts to slowly decrease, it will slowly come down when you stay in that scenario. And then you will learn that you can deal with that situation. So you don't have to be fearful, you don't have to be anxious. So how you create the hierarchy and you work through it and you sit through it. And going back to the safety behaviour, so the idea of carrying like toilet roll and wet wipes, there may be certain things you carry with you or certain things that you do that you feel helps to reduce that anxiety, but realistically you're not able to deal with the situation. For example, alcohol. Some people feel like, oh, I need to have a drink to go into a social situation, but then you become reliant on it, that you can only be in a social situation if you've drank alcohol. So again, being really, really mindful of that situation and how kind of your response to it. So that's how you would kind of work over, as I said, the connection with the smell, so with exposure response prevention. But as I said, that also links into difficult social situations, any situation that you feel anxious really. Because our thoughts will pass, our emotions will pass. The more we attach to thoughts, to emotions, the stronger they become. Say, for example, if you've ever tried to really, really not think of something, you're going to think of it, because the fact of you saying not thinking about it, you're thinking about it. So, example, if you're craving a certain food because you think that you really want it, the more you're telling yourself, I don't know, don't think about chocolate. I don't really want chocolate. You're putting that thought in your mind, and that's where it comes back to the 5, 4, 3, 2, 1 technique, where it comes back to really being curious with your thoughts, asking them if they're thought or opinion, challenging them, being in court again. So the connection between your thoughts, your feelings and your behaviour and your physical sensations is really, really closely linked. And actually someone mentioned to do with the physical sensations that people have with IBS. How can you manage them? And again, it's almost that idea of the acceptance, and it's not paying too much attention, because the more you focus on physical sensations, or more you tell yourself not to feel it, the stronger they're going to become. So it's about accepting that you're feeling these physical sensations, but not feeding into them. So you accept them, you recognise that you're there, but you allow them to be there. And in doing so, then you could distract yourself through meditation, or you could do something again like the 5, 4, 3, 2, 1. Refocus your attention on something else. So perhaps go listen to a piece of music, and the thought about the physical sensations will come up again. You can't tell yourself once not to have a thought and it not to come up. You have to continue to condition yourself to recognise the physical sensation, that feeling in your tummy, knowing that it's not comfortable, but not just sitting there and being like, oh, I can't do anything. Do something with, because carrying on with your daily life by doing certain other things, and you're not giving the physical sensation the power to overcome. Obviously, there's going to be sometimes when we are in a lot of pain, but the more we're able to push and just even do little things to change our behaviour, the better things are going to become. So just to go over, like, really watching your thoughts is really, really key. And I would really like to direct people to, I've got a YouTube channel and I've got loads of different meditations, and there's one to do with obsessive thoughts. So it's not just to do with OCD, it's just those thoughts that are really, really difficult to really overcome and to get through. And hopefully in terms of the meditation, that's something that will be really key. And going back to the mindful eating, that I think that often when we eat, we rarely actually just eat. Like, when was the last time you just sat down and just ate, rather than thinking about loads of other different things that are going on in your mind, talking to other people, being on your phone, being on your laptop? We often are so preoccupied with other things in our mind that we're not actually just in the moment with the food and what we're eating. And that's the idea of mindfulness. It's changing that relationship with the food. So going back to not eating just for stress, or not eating because we're feeling really overwhelmed. It's just being in that moment and allowing ourselves to be with the food. So that is, again, like a really key technique to be able to change our relationship with our food. But I would recommend everyone to kind of looking at the logs, looking at why we eat, how we eat. So you could literally do quite a simple table. So you'd have the situation when you eat, the emotion that you're feeling, any thoughts that you have, any physical sensations that you have, and potentially looking at what you eat, where you eat. And if you notice, as I said, that when you always come in from work, you feel stressed, you go and grab something that's the easiest thing to grab. But that's also always not going to be the most nutritious thing for you, or the one thing that doesn't really fit in as well with our eating habits. So that will be my first key of where to start. And as I mentioned, using some of the techniques to challenge our thoughts, looking at our relationship with our food, and looking at also an important thing to think about is, what do we do after we eat? Do we feel guilt? Do we really critique ourselves? So being quite kind to ourselves, not always criticising ourselves for doing certain things because we haven't done it right. We're all learning. We're all on a journey to be able to understand how to deal with things better. So they are the key elements that I would recommend. I will leave some of my contact details in the bar on the group, so anyone can contact me if you've got some more questions. And if anyone would like to have a copy of the mindfulness eating ebook, then just let me know. And I'll put my Instagram on there, because I'm more active on Instagram, and I post a lot of meditations. I post a lot of CBT psychology tips, which I think would be helpful for most people to really get a grip on and kind of really bring it into your life. And also, as I mentioned with the YouTube, there's quite a lot of different meditations on there which people could use to be able to manage with your thoughts, or just to kind of manage your relationship with food, to reduce your stress. There's loads of them on there. So yeah, I really am grateful for everyone for watching. Sorry with a bit of the hiccup at the beginning, but I hope you've got some stuff out of this. And as I said, if you do want to ask me anything from what I've said, then please, just drop me a message. But thank you, and hope you have a good rest of your Sunday. Take care.